Good evening, everyone. I'm Dr. Maunika, Regional Medical Advisor from Shield Healthcare. I welcome you all for today's session, Dialogue and Discourse, Population Stabilization and Women Empowerment. I welcome our host, Dr. Sadhana Gupta, ma'am. She's an MBBS gold medalist, MS gold medalist, MNAM, FICOG, FICMCH, FICMU, and she's a co-chair SAFOG NCD Committee, FOGSI representative to SAFOG 2018 to 21. She is a Vice President FOGSI 2016, ICOG Governing Council member from 2015 to 21 with Best Governing Council Award 21, corresponding National Editor and Peer Reviewer, Junior OBGYN India and Junior SAFOG. She is a FOGSI past chairperson, FOGSI Safe Motherhood Committee with FOGSI Dr. Mehrudara Hanchotia Award for Best Committee Activity.
It's okay.
I welcome you, ma'am, and I hand over the session to you.
Thank you, Shield, and a warm welcome to our dignitaries and leaders, mentors on this dialogue and discourse on the fertility issues in our country, population stabilization, and women empowerment. So it's a great pleasure to have the mentors in our field, Madam Shri Dr. Usha Sharma, President WW Foundation, Dr. Meera Agnihotri, Dr. Ritu Joshi, and Dr. Shobha Gudi, who have done exemplary work in field of population stabilization. So it's a great pleasure to have Padam Shri Dr. Usha Sharma with us, who have been a key figure all over India, who have faced the challenges of population stabilization in 80s. She has been the ex-Director General Medical Education, Uttar Pradesh, Principal cum Professor of OB-GYN at LLRM Medical College, Meerut, lifetime Chief Patron of UPCOG. And
I think of, Sadhana, isko short kar de.
Ji. So to actually say that Madam has the record tubectomy, a number of tubectomies in a camp, and she has been like an inspiring figure for in the field of population stabilization, and has been awarded. We can see it that then President Gyani Jail Singh awarding Madam Shri to Dr. Usha Sharma. It's an honor to have you, Madam. And it's a great pleasure to have Dr. Meera Agnihotri, who has been an inspiration to generations of OB-GYN. She has been the professor and head OB-GYN GSVM Medical College, Kanpur, Chairman, Ethics and Research State Medical Council, and what is important, yes. So she is President WW Foundation, and not only she has been a ardent academician teacher. Actually, up to this moment, she is so active in the field of women empowerment, and it is really great to have her input on the subject. It's a great pleasure to have Dr. Ritu Joshi with us, who have made the imprint on FOGSI as a chairperson, Family Welfare Committee. She has been awarded Dr. Mehru Ansotia Award for the best committee when she was the chairperson of the Family Welfare. She is Senior Consultant Fortis Sport in Surya Hospital, Jaipur, Vice President FOGSI 2014, and Chairperson Family Welfare Committee from 2009 to 2012. And what we say that we remember her tenure as a Best Committee Awardee for the FOGSI. Dr. Shobha Gudi is with us, and who has done tirelessly, and what we can say, she is the among this generation of leaders, she has been a key voice for the population stabilization, passionate about the subject, and professor and head of the department St. Philomena's Hospital, Bangalore, postgraduate teacher and examiner, and President BSOG 2018 to 19, and Chairperson Family Welfare Committee FOGSI 1922. So a warm welcome to everyone, and I hope that this topic, why we have taken it as the first talk for the dialogue and discourse, because just a few months ago, the India was, welcome Dr. Ritu Joshi, welcome. So India was crossed China now we are the most populous country of the world, and we are the third largest economy at the same time. And how we can actually find solution to the challenges of that the large number of heterogeneous population about family welfare services. We have a really very history which we can be proud of, though we are the one of the most populous country of the world, yet we have been the pioneer, because the India was the first country in the world who started the national family planning program. India was the one of the few country where the MTP legalization and liberalization was done in our country. And India was the first country who have the like this camp approach, which is targeting thousands of people in the family planning program. We had a history, what we will like to have opinion of everybody, that in 1975 we have emergency, and that was the time actually a lot of things, the financial low, the prices of oil and so many things, and the emergency came with the portion of them, especially the male sterilization. And after that debacle of government in subsequent election, and after that we really had, because government for 10 or 15 years don't have the courage to take family planning as the main policy. We totally omitted the male participation because of that experience at political front. And now when the India really has the like 75th year of independence we are celebrating, and going to be the one of the largest economy, what we are there, how we can contribute and how we can find solution to the challenges, this we will learn from our mentors and the leaders in the field. So Dr. Usha Sharma, because the first thing that you have seen, I mean, first question will be to Dr. Usha Sharma as well as Dr. Meera Agnihotri, madam, because you have seen that time. So what have been your experience, that what were the issues when there was 60s, 70s, and slowly this technology of lab sterilization came, and how that was correct or that time, or there was no alternative? What was your experience, and what we can learn from that experience from 60s to 80s, what we can say?
Sadhana, you have already told, I can say, the tips of the things which we have seen in the last, I think, five decades. And you are very right that we all know that population explosion is the biggest problem of our country. Though we were the first one, as you said, in 1951 to start the family planning program, but unfortunately we have not been able to achieve what we could have. And हम ये भी नहीं कह सकते कि हमने कुछ अचीव नहीं किया, अचीव तो किया, लेकिन उसके बावजूद, जैसे अगर आप फर्टिलिटी का देखिए तो हम लोग के हालांकि अनमेट नीड अब भी 9.4% है. फर्टिलिटी रेट, you know, it was 2.9 in 2003 and now it is only 2.1. अगर हम ग्रोथ रेट देखें तो ग्रोथ रेट हमारी 25.85 थी in 2003 and now in 2023 it is 20.35. So certainly we have made a difference. But what I feel, that when it was a time of permanent sterilization, in 1970s we know that permanent sterilizations were introduced, as well as the legalization of abortion was also implemented. But what I feel, that the problem in our policy is, if a thing is well accepted, we try to run fast. Like at that time, I will say we were having vaginal ligations and mini lap ligations. But the thing is that there was some problem because the surgeons were not well trained in vaginal ligations. But what happened? Camps. I totally agree that in a populous country like India, camps are very, very necessary. At that time, not now, at that time the thing was that it was a wave of family planning. And in 76 and 77, when national population policy was implemented, at that time, no doubt that our target was about 4.5 million of sterilization, but we did 8.3 million. Certainly, there was a need of that program. But then what happened? Just because when we saw that lab ligation is being accepted very well by the public, we just wanted to do it in more and more and more number. And I think that was not a correct policy, because till the surgeons are well trained, till you have good team to just examine the patients. Because what I feel, whatever surgery you do, it may be a minor surgery or a major surgery, selection of the patient is very, very important. And not only selection, counseling of the patient is very important. And so then what happened, that when only we were thinking of numbers, numbers, numbers. So what I feel, that if any method is well accepted by the public or by the client, we should try to maintain the quality of that services. If we will maintain the quality of the services, then, because any method of family planning cannot be successful till there is prolonged acceptability. Number one, there should be prolonged acceptability. Number two, there should be accessibility, that you can provide those services. Then affordability, and then good follow-up and good counseling. So all these things are very, very important. We tried our level best at that time, but then certainly there were side effects and complications. That's why any method goes into disrepute. Like, even I will say vaginal ligation was a very good method and a very simple method, but it went into disrepute because trained surgeons did not do it. Even postgraduates tried to do it because there was so large population coming forward for this. So what I feel, that when, like, what happened when Indira Gandhi did all this, like, actually it was Sanjay Gandhi who did that permanent sterilization, and no doubt that he did wonders. And then at that time, we were having large number of sterilizations, but along with that, we should have followed up the cases well, and then we should have counseled the patient well. And so these things are very, very important for any method to be acceptable for prolonged period. Otherwise, you will not be able to achieve your target. And then we all know that along with this, quality of services is needed. And at that time, male sterilization was not considered. And every time the females were pushed in front, ki tum jaake kara lo, tum jaake kara lo. And I tell you, when I used to do these laparoscopic camp, you will not believe, at that time, एक दिन पहले 300, 400, 500 मरीज एडमिट हो जाते थे. My team used to go there a evening before. They used to examine each and every case, and then they will put the difficult cases, or in which they say they are not fit. Then I will go in early in the morning and will just see which are the cases who are absolutely fit. And then I did ligations. But this type of facility is not with every surgeon. I was head of the department of a medical college. So I had a team of 8 to 10 persons with me, including the staff nurse I used to take. Even the bearer was going with me to that place. So जब तक की facilities इन चीजों की नहीं मिलेंगी, तब तक ये चीजें बहुत problem वाली हैं. इसलिए after some time, परमानेंट स्टेरिलाइजेशन, वो कहते हैं ना, जब इंदिरा गांधी दोबारा से पावर में आई, एक्चुअली it was a great setback in the journey of sterilization or the population problem of India in 1977, when the there was defeat of Indira Gandhi, and no other party could have dared to go for the permanent sterilization. And then we came to realize that actually permanent sterilization is not the only method by which we can stop the population, but we should give a spacing method, which is much more important, because nowadays what is happening, we know that this spacing is only in 49.1% of the birth. They are producing children after 1 year, after 2 years. और इसीलिए फिर हमारे यहाँ नेशनल पॉपुलेशन पॉलिसी बनी, जैसे हमने 1970 में कहा 2 या 3 बस, फिर 1980 में कहा हम 2 हमारे 2, और फिर हमने आजकल जो हम कह रहे हैं, हम ये कह रहे हैं कि लड़का हो या लड़की सिर्फ 2 ही काफी, और पूरी तरीके से उनका टीकाकरण जरूरी है. So what I feel that not only permanent sterilization, we should concentrate on spacing methods also, and postpartum intrauterine contraceptive device, which is very, very important. हम लोगों को postpartum में जरूर ध्यान देना चाहिए, इसीलिए इन सब चीजों का बहुत जरूरी है. आजकल लार्क तो जैसे हम long acting contraceptive device के लिए. Yes.
One thing I will like to ask Dr. Meera Agnihotri and Dr. Ritu Joshi. Madam told a lot of things about that time and how the things come, and actually that was an emergency situation for our country.
Yes.
There was nothing wrong because we are having emergency and we have the less resources, so there were, if we will do certain, but there will be some lapses, so there is no issue about it. That I will Dr. Meera Agnihotri has done a lot of things on women empowerment, and Dr. Ritu Joshi is one of the very strong voice for the women empowerment. How at that time, then the year passed, and इको आ रहा है,
कोई बोल रहा है, कोई बोल रहा है, अदर को म्यूट कर दीजिए.
I think there is an echo. There is an echo.
तुम्हारी बात रिपीट हो रही है.
So how the women, because there were like लोगों को कहा जाता था हम जमीन करा देंगे, आपके नाम आप sterilization करा लीजिए. Then coming to the patient's choice, what madam says, it should not be targeted, it should be the choice. So Dr. Ritu and Dr. Meera Agnihotri, Dr. Meera Agnihotri, are you there? No? So your comment that how the women empowerment and making their choice actually is intertwined with the acceptance of the what we say the family planning method. So Dr. Ritu, your comment about it.
See, I think, as Dr. Usha Sharma has already spoken about her time period, when I entered into this FOGSI, I figured out that it was actually sensitization of the doctors was equally required. We as doctors were not putting in any efforts in speaking to the patients, the women, even their families about the contraceptive methods or anything to be taken up for family welfare. So FOGSI played a very major role at that time. And a lot of presidents, past presidents of FOGSI made it a point to be their topic or their main concern during their year of being presidents. I remember Dr. Sadhana Desai was one of the first ones who took up population stabilization as her topic of the year. So she really worked very hard on emergency contraception at that time. Then after that, Dr. C.N. Purandre, we had Dr. Sanjay Gupta, and we had organized, a lot of conferences, fortunately on population stabilization, which were a great success. Secondly, FOGSI also did a lot of workshops along with the policymakers, stakeholders like PSI. We had, where we did a lot of work with the IUCDs with them. And we had a whole lot with, now Dr. Shobha Goodil will tell you how many we had really worked with. We had workshops and we were not bothered. MSD was also a very major part of it. And we had a lot of these workshops in which we were not bothered how many people were attending it. And we used to feel that even if there are 10 people in the workshop, we are very happy with it because we have sensitized those 10 people to that. And today I'm so happy to see that I mean, any workshop which is on population stabilization in any way has been a big success. Secondly, we worked with these pharmaceutical companies, like MSD was one of them, which we did a lot of work with them on populations. I mean, on contraception. We made a lot of pamphlets, flyers to be given to the patients. How what are the methods? How to choose a method? The counseling flyers were them that this is how telling them about what are you using, is it right for you, is it wrong for you, all those things we did a lot. So that sensitized us as doctors, and we did a lot of we took out FOGSI focuses which were on contraception, which could reach even the C societies of our FOGSI, and that's how we really got into it as FOGSI. And we reached every doctor sensitive. We had forgotten about IUCDs. We ourselves never used to speak about these lab methods. And I remember once going to Patna for some postpartum contraception survey on behalf of FOGSI. And I figured out 23-year-old women, they were all sterilized. So they were not aware of even IUCDs. And the other thing which I figured out was that during those times, these ASHA workers were paid more money if they brought the patient for sterilization. If they brought the patient to a doctor for IUCD, she was getting very less. So that was the other reason why we figured out that this was the change. But I'm very happy now that with the advent of so many contraceptive methods now available in the public basket, let's put it as that way, because implant also now the government is planning to bring, which is really a wonderful which is a boon for our women today. And we really must work more hard, and hopefully if you become the president, we would move faster on towards on this.
True,
and
true.
I really feel sorry that we do not have anything for the male sterilization. Like, I'm in Jaipur, and even I have to really, even if a male agrees to it, I have no one to guide him to do an NSV. Yeah? So this is so surprising. The urologist will make it a very big issue, get so many tests done, then come back to us, which I think, we should move a little more forward. So Sadhana, keep
Yes,
that
that
as
is
one of
very
your
important.
points of during your presidency.
Yes, that is very, very important. And as you said, Ritu, I also totally agree that cafeteria approach is very, very important. No doubt that at that time in 80s, there was need of such a great thing like sterilization and everything. But certainly it cannot be used permanently. Until we have spacing methods implemented, and just we have to counsel, just talk to it's our responsibility, talk to every patient, every mother-in-law, every daughter-in-law regarding the use of family planning and the need of family planning. And that is why I always say it should be client's choice, not the doctor's choice. आजकल कई बार ऐसा होता है, डॉक्टर जब ओपीडी में बैठी होती है, भाई देखो ऐसा है, तुम इस चीज को इस्तेमाल करो, ये बड़ी अच्छी है, लेकिन we should tell these are the methods available for you and now you choose. But if it will not suit you, then I will advise you what should you do. And then breaking the myths is very, very important. पर हम लोगों को अपने आप टाइम नहीं बर्बाद करते हैं। हमें ये सोचना चाहिए कि एज ए पार्ट ऑफ दिस कंट्री वी शुड गिव इनफ टाइम टू द पेशेंट्स, जिससे कि ज्यादा से ज्यादा लेडीज फैमिली प्लानिंग अडॉप्ट करें और वो मेथड अडॉप्ट करें जो उन्हें अच्छा भी लगे और उनके लिए अच्छा, मतलब इवन दैट इज वर्किंग फॉर देम। सो व्हाट आई फील कि थोड़ा सा हम लोगों को contribute zyada karna chahiye. Not that I am boasting, but I tell you, at that time when I was doing sterilization, in a day I was doing 500, 600 cases. I used to go in the morning at 4 o'clock and I used to come back at 10 o'clock in the night. But, It was a great satisfaction for me. And so we should all try to satisfy our soul that as a part of this country, as a medical professional of this country, we are contributing our best. And so we should just tell them, we should counsel them, we should break the myths, and we should give some time so that our country is out of this population explosion problem.
Thank you, madam.
I
Thank
agree.
you.
Sadhana, let me interrupt
Yes,
over
yes.
here. I agree
Yes,
with
yes.
Dr. Usha Sharma telling us, madam, that counseling is really a very, very, very big thing. I think, we should also grab some opportunities to talk to the women about it. Now, if she's coming with a white discharge, we should immediately ask her, are you using any contraceptive method or not?
That's
what
what
are you
I
not
said,
using?
that every
We don't
patient
take
comes
that
in.
up.
Yes.
And secondly, I remember we had done a study at our time on a select study, which was for counseling. So we questioned the women as to what are the methods you are aware of and what are you using. And then we counseled them that, this actually is not the right method for you. These are the reasons. You just go through all this and come back to us. And we found that they did change to the method of what they were really wanting to take up, which
We
also
have
was
to give
taking
some
care of
time.
their medical this thing.
Yes,
But
yes. You are right,
surprisingly, I'm going to present my paper has been accepted in FOGSI, FIGO, and I had made a paper on knowledge, attitude, and practice of emergency contraceptives amongst the healthcare providers. And you will be shocked, that most of these OT staffs, the nursing staffs, were really not aware of the emergency contraception. They knew there is something like that. How is it to be used? Can we give it off the counter? They were really not aware of it, which is very surprising. I think we should work a little more hard towards that.
Yes.
So thank you, Dr. Ritu, for recapturing the FOGSI journey and all precedent what they have done. And actually, it really made a change. And few things what we said, doctor, what you said, emphasize the counseling and the taking, like all the things. I think Dr. Shobha Gudi has taken these issues, that the proper counseling, what Ritu has said, that nobody was aware of the emergency contraception. And we also had some barriers about the use of medical, like when the patient says to us that I have taken 3 times emergency contraception, we are a little bit annoyed and feel them very irresponsible sort of thing. So Dr. Shobha, in the last 3 or 4 years, she is actually filling the gaps in those counseling area, timing, knowledge. Dr. Shobha, it will be great you share your journey, that because what Dr. Usha Sharma, Dr. Ritu Joshi pointed out the gaps, and you really worked for bridging in the very earthy manner, what we can say, reaching to OB-GYN, reaching to paramedical. So your comment, Doc, how was your journey and what you look forward?
Yeah, thank you, Sadhana ji. And am I audible well? Is it okay? My volume?
Yes, audible and visible. Yes.
So at the beginning, I really compliment you for bringing this dialogue and discourse on population stabilization, because very, very few present and future leaders will think of this subject, bringing it as a standalone matter for discussion. And I compliment you for your visionary approach to this subject. And my pranams to the big doyens, Usha ma'am and Meera ma'am. You have been our inspiration. You are the guiding light for many, many Foxians. And may you ever be like this for us. Really inspiring to be with both of, sharing the platform with both of you. And Ritu ma'am has been my guiding light from before, when I was chairperson, when I was national coordinator. She was the one to encourage me, and she saw the potential and said that you don't give up this committee, you must do it. And she and Basab have made me what I am today, because after Dr. Hema brought me onto this path during her presidency, it was both of them who guided me here. So when I took up the chairpersonship, as Dr. Ritu Joshi clearly pointed out, we do send out feelers to see what is there. And as she rightly said, that the provider bias I found to be very, very high. And Sadhana ji, in the private sector, there is no program for family planning. Of course, the government has the oldest family planning program in the world. Wonderfully, it has worked. It has got so many kind of dimensions. In every kind of part, it has done fabulous job, and that is very evident in the NFHS 1920. And those who have cared to look at the NFHS 1920, they know that the fertility rate has improved in several states, barring one or two. That contraception uptake has improved remarkably. It has at last crossed that magic number of 50%. So it's currently around 56%. Modern contraception prevalence rate is around 56 to 57%. But it needs to become 70%. And if it can inch above 70%, we have some hope of population stabilization in the coming years. Well, having said that, when we started our work, just like Dr. Joshi also pointed out, I was tremendously supported by the presidents of all the 3 years, Dr. Alpesh Gandhi, Dr. Shanta Kumari, and also, Dr. Nandita Palshetkar before that. She was the first one under whom I worked, and she gave us all encouragement. She was actually a very favorite for chairpersons because she would sit and listen to our, work. That was the first year. It was only in the pandemic era that when the webinars caught up, we were able to make a mark, to be very, very honest, because this is a subject wherein, traveling and doing CMEs can be a challenge. Because always we find that, that this is a subject which everybody wants to perform, but they don't know how to. So I must thank all the societies, Sadhana ji, and it is amazing to see the academic potential of FOGSI societies, because they have enormous interest and academic passion in this field also. It is not just that they want to do infertility and endoscopy. I was very well received by every society, and they said that, yes, we want to do a session on contraception and family planning. So a few highlights which we did was, of course, I think PPIU3 will come in the next part of the discussion. I wanted to say that we did attempt to do a paramedical training, and we had a medical officers and paramedical training. We did a counseling workshop for them online. We also tried to do a lot of training for implant, the Implanon NXT, the new one, etonorgestrel, and we were able to successfully kind of make it a known product, which is and then it has come into the government basket, in the sense that I can safely say that FOGSI started the conversation for contraceptive implant, and later on the government kind of took it up. Of course, anything that the government of India takes up becomes a huge success in family planning, and we are looking forward to that. So soon it will be in the public basket, and women will be getting it inserted. That's a very huge positive step, and the same thing needs to happen in the private sector. So my observations were that private sector falls behind in counseling, and therefore we had a very strong feeling that we should integrate contraceptive care with clinical care, because this divide between public health and clinical health is what is a main barrier for contraception uptake, because consultants simply cannot source the time which is required to offer the basket of choice in a constructive way, to do the general counseling, the method specific counseling, give a schedule for follow-up visit. It is a lot of work. So we need to have a support structure which allows us to ensure the reproductive rights of women who come seeking for care. Not many of them don't know that they have an unmet need for contraception. And Dr. Ritu very correctly pointed out that any woman walking in with any other symptom should be tapped for her unmet need for contraception. Many of them have it. So unless a woman is postmenopausal or she has had a hysterectomy, she has and she has not tubectomized, she has a need for contraception. So therefore, we must take that. And I did try to bring in the concept of integrated eye care clinics, where we can have a small cubicle on the OPD floor, and when we can have trained counselors, we can have all the methods displayed, the charts and the IEC material, and we try to bring out structured IEC materials. Also, we release them from time to time in the managing committee meetings. It's all there with me, Sadhana ji, or in addition to what Dr. Ritu Joshi has done, we could kind of use all this material for the societies in the coming years. So the concept of eye care clinic really appealed to some, and I'm very fortunate that in the Medical College Varda, Dr. Poonam was able to start it, and Poonam Shivkumar and her team were able to start the eye care clinic. Sanjeevni Vanjare also was the resource faculty for that, and they have found a very wonderful response for the clinic. And like that, few others have given me data. Family planning, we need a lot of collaboration, and we try to become an important part of ARC, that is advocating reproductive choices. We stayed inside the core committee of ARC through an election, in which FOGSI kind of retained its position during my tenure, and there was a lot of work done for that. And I think we collaborated very constructively with FPAI, with PSI, and also with IPAS, and also with several pharmaceutical companies. Collaborative effort is the key. And I will
Dr.
say
Shobha,
again,
we had done it, a lovely certification course with the Pathfinders and all.
Yes,
and that was very popular.
Very popular,
because it could give them the certification and to join the family welfare, the family planning clinics.
Correct.
That was really fantastic.
Done by PHFI. It was done in Dr. Basar Mukherjee's tenure. And we had all been,
yes, we all have been part of it. And how the PHFI actually, that is the strength of networking, because they could have a module, a lot of things which we actually cannot do, because they have that all the resources for that, and that can be so interesting, like the role plays about the thing and how to do counseling. So it gives really messages to how to talk and how to do the things. One thing, Dr. Ritu and Dr. Shobha, what you say, I reside close to Nepal, and I actually had the experience of DIMPA much before it came to India. We regular have the women coming with the implants, and they say that it is going. How it is the like an international scenario, especially to Dr. Ritu Joshi, that we India take a longer time to accept any new method, or it is something about donors, because in many countries it is being used, like DIMPA was used much before, and we took a lot time and a lot of issue about bone mineral density. So what you say that still implants are not that freely available. So what you say that how as a professional body we can make a voice that every contraception which is new, which is available to our population.
I feel that, first and foremost, every contraception is safe for the woman. First and foremost, looking into her medical morbidities, if there are any of them present. And secondly, as far as the DIMPA was concerned, the women were demanding it.
Yes.
Can you imagine that the women were asking, and especially, I don't know if this is the right platform or not, but I found for religious reasons, most of the Muslim women were very happy with DIMPA.
Yes.
Because it used to allow them to, go in for the namaz every time, and they didn't have to bother about any of those things. So they were totally amenoric and very happy. Now, there was this black box which was attached to it, that it causes bone mineral density loss and all, which when series and series of work was being done, it was removed from there. So I easily give I am open about it to give it to my clients DIMPA. The only thing is that I do add in calcium to it. That's all. And I found that even in the perimenopausal age group, I think giving this DIMPA was really good. And today, we've started getting the subcutaneous one, that she doesn't need to go to the facilities to take her injections. So that's the other, and then she can keep a privacy of that for herself. So the only thing which it does is it increases the weight, which is the water retention weight, and it finishes off as soon, not even 500 grams or something, and it goes away as soon as she stops it. The negative of that is the weight, and the second thing is that the return of the fertility is comparatively less. But I have been using it even in patients with adenomyosis. I'm quite frank that in case if they're in the mid cycle of theirs, of their age group, I really, if they have adenomyosis, I recommend it a lot. And we've been successful. They're very happy. Sometimes, they don't want something like an LNG IUS, which is inside them. A lot of women have that apprehension. So we have this with us now. And the privacy is there because the subcutaneous ones are available. Now we have implants knocking on our door. They're already there. We still have to train our people with Dr. Shobha Guddi during her time as a chairperson had done. And we still, I think the Family Planning Association of India is very much into it. So we have another method with us available. And so we have a lot of, methods which we can really counsel our women and ask them to start using whatever suits them mentally and their health wise. And they are in the public sector.
Yes, you are right, Ritu. What I feel that every method is a good method. Yeah. Because whenever it comes in the market or whenever it is just for the public, every method is a good method, provided we have time to counsel a patient and to follow up a patient and satisfy her if she has got any problem. The problem is with us actually, because whenever if a lady comes and हम लोग क्या कहते, चलो भाई तुम अच्छा ये है, तुम चलो इसको लगवा लो, करवा लो, but then we disappear from the picture because we do not actually follow up the patient. कोई सी भी आदमी को, हम पढ़े लिखे लोग हैं, फिर भी अगर हमें कोई नई चीज बताता है तो हम उसको करना चाहते हैं, प्रोवाइडेड जो हमें बताता है वो हमारा बाद में भी साथ दे अगर हमें कुछ कॉम्प्लिकेशन है या साइड इफेक्ट्स है. तो मेन थिंग यहाँ हम लोगों का रोल आता है. अगर देखिए तो सारे मेथड्स अच्छे हैं. सर्टेनली पर्सन टू पर्सन डिफर करता है कि किसको ये मेथड सूट करेगा, पर एक्चुअली हम सबको भी इतनी ट्रेनिंग होनी चाहिए, हम सब में भी इतनी पेशेंस होनी चाहिए कि हम अपने पेशेंट को अच्छी तरह समझाएं, काउंसिल करें, और यही नहीं कि बहुत अच्छा है बहुत अच्छा है, उसके थोड़े बहुत साइड इफेक्ट्स भी बताएं, और ये भी बताएं कि साइड इफेक्ट्स हो सकते हैं लेकिन इसमें कोई प्रॉब्लम नहीं है कि यू हैव टू डिसकंटिन्यू इट. सो our role is very important. So, I'm sorry to say that we have not been able to play our role satisfactorily.
Thank you, ma'am. I certainly agree to you. You'll be surprised. There's an NGO working Earth in Udaipur in Rajasthan. Yes. And can you imagine they're easily satisfying women for LNG IUS? Yes. And the women are accepting it. यहाँ हम लोग कॉन्ट्रासेप्टिव यूज के लिए LNG IUS बोलते ही नहीं है, हम तो AUB के लिए बोलते हैं उनको, which is surprising, but this NGO convinces and they have used the maximum LNG IUS and they procure it at a very reasonable rate.
बहुत impressive काम है.
Actually, Dr. Ritu, that will what Madam says and you says that NGO are able to convince. So I think this is the time, like what we had a postpartum program in all district hospital and medical college, and that really played a very, very important role in postpartum program. So it is not so, maybe our gynecologists also have their own concern. And what Dr. Shobha says is that we don't have that, like what we say, the support. So important thing, I think, Madam, the carry forward is this, that we have this, what we have done, a counselor sort of thing. Give them what all the things to be displayed, because sometimes what happens, few genuine thing that like when we say this thing, then there are again one question, there is one question, and sometimes the gynecologists who are like known for their a little like impatience due to a lot of things going on. So this is time that Dr. Ritu and Dr. Shobha has actually done a very, very important work, that we must have a 1 or 2% who have the patience and say to everything. So that cadre, that in between, that the trained counselor for
Definitely,
family
it is
planning,
needed. Yes.
and the second is the quality care. That is very important. Why
Yes,
our
yes.
China is doing a lot of IUCD, 80%, a little bit. Yes, there are one government party, but it is the quality of issue also in IUCD insertion. So all what Dr. Ritu was talking about, all workshop, how to place the IUCD, and 3 days workshop for the PP IUCD, which we think that it is so easy, but the 3 days workshop for the postpartum IUCD. So few think that it has to be taken as respect. सभी लोग बोलते हैं कि जब हम IVF के लिए पेशेंट को काउंसिल कर सकते हैं, so why not we encourage them to spend 2 lakhs rupees for a 30-40% pregnancy rate, so then why we cannot do? So few complexities of Indian population we will touch in the next 15 to 20 minutes. Always the adolescent, including all over the world, is including India, are sexually active. In our setup, they are married also, especially in some regions and the rural areas. So, and the POXO Act says that any sexual act is a crime before 18 years. And then it is a POXO Act, the adolescent access to contraception, adolescent access to, if needed, safe sex and safe abortion service. So what's your takeaway, Dr. Ritu and Dr. Shobha? Daily we are having these girls coming on their own with their boyfriend, informing police, tell or not to tell about what our legal people say. If we are saying that use this contraceptive, then you are like assisting in the crime which is called POXO Act. So how we can actually where is the average gynecologist? They are so fearful, or how do they should they go ahead? Dr. Ritu and Dr. Shobha.
Sadhana, can I beg excuse?
Yes, madam.
Because
yes, madam.
I had to go, I told you, and it was a real pleasure with Shobha and Ritu. Really, we are the ones who can persuade doctors to give a little more time.
Correct.
Because we are part of this country. We want that our country should progress, but our country can never progress if we cannot control the population. So thank you very much. It
Thank you, madam.
Very valuable suggestions you people gave, and it was a real pleasure for me. And Sadhana, I must appreciate and admire your capability and competence. And I'm sure that you in future also, as a President FOGSI, God forbid, if ऐसा ही हो जाए, ईश्वर करे, then you will do a lot. Thank you very much. I'm sorry
Thank you,
that I
madam.
had to.
Thank you.
Thanks,
Thank you,
ma'am.
Usha,
Good day
madam.
to you.
Thank
Thank
you,
you.
madam.
Thank you, Usha,
Thank
madam.
you.
Thank you.
Thank you, madam. Dr. Meera has got some connectivity, because when she started, something happens in the screen. So, Dr. Ritu, what's your takeaway about all this adolescent POXO, MTP Act, and how we should go ahead with this a very sensitive issue in our country?
See, again and again, let's say counseling, counseling, and counseling. Okay. Take any opportunity which we get, please explain to them about the contraceptive methods. And not only to them, even the family. Sometimes, the mother-in-law plays a very major role. Kapati nahi lagane ka hai, aur kuch nahi dene ka hai, that kinds. So we must explain to them also that your time of kapati was very different, because most of them got it during those time periods where, a drive was there by the government ki sabko kapati laga do, sabko ye kar, sterilization kar do. But I feel that for a woman, it is, she should preserve her own health. She should take care of her own health. And she is actually the pillar in the family. If she is going to go on and on producing kids, I think her own health is going to deteriorate. So we must explain quite a few ways to them as to accept the contraceptive methods. And of course, we had been, during my time, there was a big drive about the postpartum IUCDs. But I still leave it open to them, because whenever I talk to them about the postpartum IUCD, that also has to be during the antenatal time period. Because, during the labor, when she says, "Mujhe koi aur bacha nahi chahiye, mujhe kuch bata do," so then, that's the time when you want to insert a postpartum IUCD. That's actually not the right thing. So we as doctors should also know right time to talk to them, right counseling for them, and right contraceptive method for them. We must really go into details about their medical history, their personal history, and what exactly she wants. I remember these when these came, these rings came. I don't know where if they vanished off. They were also a fantastic one. That but that zone change when you give them the tablet, fixed time pe lena, aise karna. She's gone to America now. That timing changes. She gets into those withdrawal, spottings and all that. So I mean that ring was fantastic for those women, and I don't know where it has gone. It's not in the market, not available now, but I hope it shows a comeback again. So ask her what is her need. They should always be tailor made. That's what I feel. Sit down, ask her why does she want a contraceptive method? What is the kind of work she does? Will she be able to take that medicine in time or not? Otherwise, she could go in for long-acting reversible contraceptive methods. And a lot of surprisingly, girls who get married and don't want a pregnancy for long, even nulliparous women are opting for IUCDs. So I think we are changing, but we need more of a push. I think that's where Dr. Shobha will also agree.
Yes,
Actually, Shobha, I think Ritu rightly that we always lie from MBBS days that the contraception it should be the way of life. But actually, finally, it has not become way of life. Neither the women or the people nor ourselves. It is still something we take it as like a additional stress, and we don't want to give. So, what you says that the adolescent, yes, LNG IUS. What all Western world says that the LNG IUS is a good method for adolescent, and we hardly any of us have the dare to say to any adolescent that use CD. So, Dr. Shobha, what you say about that, like a people's place about this adolescent sexuality? Because here is the thing, all the things arises. It is unsafe sex, STIs, unsafe abortion, and then this vicious cycle. How you see it?
And the POXO Act. And the POXO
Act, which is...
So I think that it is a problem. And I think first and foremost, we must understand that this is a huge population to which we have to cater, because we have 1/3 of Indians of this huge population as youth, right? And this is actually a demographic dividend, because if we mold them well, then they are kind of the bright future of India. So this demographic dividend should not become a demographic disaster. That means if we allow them to pass through this phase without proper knowledge about sexual reproductive health, they will not understand the value of reproductive planning or planned parenthood or spacing between pregnancy, and we will continue to face the problem of, not able to reach stabilization of population. So I think today the burden on gynecologists is very high, as always, but today it is high. साधना जी, मैं आपसे ये कहना चाहती हूँ कि रेस्पेक्टफुल मैटरनिटी केयर तो हो गया, रेस्पेक्टफुल मैटरनल केयर. It is time we had respectful reproductive health care or something like that, where we can give this advice with an atmosphere of real respect and freedom and open space. And I mean, they should not feel hesitant to speak out their problems. It is okay if they have taken a decision to be sexual before marriage, to become, sexually active before marriage. It is a decision they take. So we need to support that decision in matters of health. What I want to say about POXO is most of our couples, young couples, they are not aware about the act. They are a very smart generation. And if they know that it is a crime to indulge in sex before either of the partners has completed 18 years, I am sure they will put off the sexual debut. So today, I think there is lack of education and awareness that there is a POXO Act in our country. And that is why we are in soup, because we have not alerted them. We find ourselves responsible to inform the local law authority that sex is happening and there is a case for abortion, and information is what is required from us, or reporting is what is required from us. So the message you have to give is that reporting is our function there, to kind of come out of the POXO Act situation for us. But what is it to the couple? The couple need to understand that it is not legally acceptable in our, it is punishable by law. And we can give them education about contraception. Giving them education about contraception is not illegal. So as Dr. Joshi also said, we have to offer all methods. So there are 2-3 things about adolescent contraception. One is that LARC methods are specifically suited for them because it is compliance independent, and they will not be very reliable clients for use of short acting methods. So dual method of contraception is the other thing. So a LARC method and a barrier method is what is the way forward for them. And the third thing is they should be strictly told that it has to be used after 18 years. Today, the main problem is we face teenage pregnancies, and I am getting reports from my colleagues that the husbands of these 17, 18-year-old girls who are delivering in government hospitals are finding themselves behind bars because the government officer has to inform the police, and they are taking and putting that poor fellow behind bars. And who will look after this girl who has just now delivered? And they will be socioeconomically, marginalized only. So instead of helping the new mother, the young new mother, this act is putting her in jeopardy. And this act is coming in the way of providing maternal health because of something which has happened, before 18 years. So it is actually backfiring in a very huge way. And if we cannot change it, because it seems obvious that nobody can do anything about it, we need to find out ways and means to go around it. And the only thing that we can do is, since the legal age of marriage is definitely more than 18 years, so we need to look at those women who are not married but are sexually active, and we can inform them that sexual
Something
abuse
very
has to be
important.
Let me
after 18
add,
years.
Dr.
Yes.
Shobha,
Whether we
something
can,
here.
Yes.
Can I add 2 things? I mean, I love the way you've spoken about the dual contraceptive methods for these adolescent girls who are not married. And secondly, also to explain to them about the emergency contraceptive method,
yes,
that it
absolutely.
should not be repeated. They with every act, even if every second day they are going to repeat, and they spoil their menstrual history. So lot many times when girls come with us that I've got delayed periods, I've got irregular periods, your first question is, do you take emergency contraceptives? Have you taken an eye pill? How often have you taken? I think the main message which we should really send across is that it's just a emergency method. We need a backup method. And yes, a dual contraception is very, very important.
Correct.
So with this, what you say that the repeated use of emergency contraception, the same thing is with the rampant and the repeated use of medical abortion. So Dr. Shobha and Ritu, what you say, to my experience, what you say that with the availability of medical abortion, which people are not taking as a abortifacient, they say something that the menstrual bleeding happens. Does it actually should have empowered the people, but somehow it is actually having the less use of contraception because people are not scared of pregnancy and they will take pills. So your takeaway about this use of medical abortion and it should encourage actually the regular contraception, but somehow on the ground level it is not happening.
It's not happening because
I agree to taking it off the counter. If she has any menstrual disorder, she will certainly come to us. So, I mean, I have no objections to her taking the MTP pills if she's in doubt and she doesn't want to tell anyone. It keeps her privacy also. But yes, we know that it is not to be repeatedly taken. So again, even after an MTP kit, when you've aborted, please go in for a regular contraceptive method.
So fine.
Certainly, I think there has to be, FOGSI has to bring out a reporting system for the pharmacies who are distributing it. I mean, who are
That
discussing
issue
it
we've been
without us.
fighting, and
That it should
MTP
be-
kits
should
have
be
been
there.
available since years and years and years now, but nothing has happened. So let us
need to
accept the
have it.
situation and help our women if she's taking it from wherever she procures it. If she has any menstrual problems, not to yell at her, why did you take a kit? At least an unwanted child has been aborted, and we can easily do, if it is incomplete abortion, help her out in that. Instead of us being a social police,
Yeah.
let us be a police, who helps them in a very empathetic way.
Certainly. But I
This
feel
is totally that medical
we
abortion.
have to correct.
think
We have to we
much
have to
better.
have a reporting system. When they have made FOGSO as a reporting system, the medical abortion kit dispenser, that pharmacy also has to be. I think that is more important than this, because that pharmacy should stop dispensing, because it can cause a lot of harm. What has happened during the pandemic, lives have been lost because the women who took the pills and could not come to the hospital when she was bleeding torrentially. And we have had reports of women dying on the way to hospital, coming to the hospital and not getting care because the hospital totally submerged in COVID patients. And that has caused a lot of harm. So
actually,
there
that
has
is
to
the
be
thing.
a reporting system for the
some
pharmacy.
certain regulations, certain things in between, because the women like they don't actually understand that it is a drug which has need the very, very careful follow up and this thing. Two thing about the government of India is having the ASHA, who is having the pregnancy kit and the contraceptive available with them, like condoms and the CUC and something. And the one way for the reaching communities, what you are also propagating, that is not what Tanu ask
Tanu, yeah.
ask Tanu. So what you say that yes, so reaching the community, what I say that reaching the community, because not everybody, that like 1.4 billion women, it is better from other country to get access to doctor, but it is not a part of routine. So what you say about the ASHA's role in the community teaching, use of contraceptive and the new digital technology for the diverse population. So Dr. Ritu and Dr. Shobha, your comment on it. Because we have the two arms to reach community, and how far they can be more effective and more impactful and more righteous way. Not the any wrong or incomplete or something fancy introduction. Ritu, first you.
Yes.
Lovely Sadhana. We've had a great time, and I remember you going for my workshops at all the places whenever, and accepted it very well as a faculty. Thank you very much, and look forward to a good year with you in case if you become. All the best wishes.
She will become. Yeah. And
of course, our wishes with you.
Thank you, Dr. Ritu.
Yeah.
And Shobha's your comment.
Yeah, I think reaching the community is what is all important today, because apart from the provider bias and barriers which we discussed so far, and the importance of counseling and offering the method of choice, I think demand generation is key. Unless the woman asks for herself, that she wants a method and she wants to check out what is available for her. I wish that that is true emancipation, when she herself understands her reproductive right and reproductive need. And then she also knows how to protect herself from an unwanted pregnancy. She puts her foot down and says that, I want this many children at this interval. That will be the day when India will become a developed country. I'm telling you, Dr. Sadhana, till the woman realizes her full potential and understands her reproductive rights, I don't think that dream will come true. I think that should happen for India. And that will be the day when most of other aspirations of the country will be met, because, women's empowerment is something which is key to progress of the nation. So for that, the reproductive rights have to be realized. And that can only be done by giving them correct information, so that they themselves come forward and then say that, okay, contraception is my right, family planning is my right. And I think one appreciation for Dr. Alpesh Gandhi's tenure and subsequently Dr. Shanta Kumari, is that they did a lot for women's empowerment. And we had GCPR guidelines which said that family planning services are essential services, which said that they are just as essential as maternal health. So that is where it is, that is how I would like to conclude that we need to reach out to the community. And today, I think women do have access to a mobile phone, and maybe about 60% of them will have a smartphone. So if they have a smartphone, we can reach out to them so much better. And that was the attempt with Ask Tanu. We did, it kind of required more tenacity, and it required more perseverance, which I could not do it because my tenure was also limited. So, but if somebody can take it forward, or I myself can revive it in some way, I think these platforms are very useful, digital platforms, because the language is a barrier. So if we can make it available in regional languages, such information on smartphone, it is a way forward. Yes, I think you have realized that digital communication can help us in family planning, more effective family planning. And for that, private sector has to have its own program of family planning. We cannot kind of, because government will not include us in their program. We need to have our own program. Yeah.
So I think we have come out with, yes, Ritu, you want to, yes, Ritu, your comment. Dr. Ritu, your.
Ritu ma'am.
Ritu, Dr. Ritu.
I think ma'am is done.
So the few, like we could have a very, very important point, and we say that the reproductive health, it is a respectful reproductive health. And somehow at a minute to minute, moment to moment, we have to be very, very careful the way we talk, the way we take their day-to-day need. Still many people are very hesitant to talk to doctor because they will be said, first we find them that they are irresponsible, what everybody is saying, that even mother-in-law, husband, every say, oh, you don't take care of this thing, but she had never knowledge of it. Secondly, we must be open to new technology, new contraceptive method, and make sure that the right information reaches them. And if the personal communication will always be there, always what the people Google or say they want to confirm it from any source. It may be it Asha, maybe it a doctor, maybe something. So that strong system must have. And as a gynecologist, like this is our very, very important responsibility, that this is our part of work, like saving mothers, because contraception itself can reduce the 25 to 30% of
family planning is life-saving.
Life-saving. So
family
these
planning
are
is life-saving.
Yes. So these are few points, and I think this is one of the foundation stone with which we can see the India as a healthy nation, as a developed nation, because this is the one of the very, very important gaps. Still we are like lacking on quality, on respect, on availability, affordability, and the private sector has to be joining hand with all the public and the national programs. So thank you very much, Dr. Ritu, Dr. Shobha, for being together. It was great
Sadhana.
discussion.
Wonderful.
Thanks, Sadhana, for giving us this opportunity. Our best wishes. But that's not the end of the story, huh? We win or we lose, we've got to fight. That's all.
Yes. Thank you.
Bye-bye.
Thank you. Bye-bye.